One of the biggest problems that we see at LKN Massage is people that have posterior neck pain, and they've always had the back of the neck massaged and worked on, but the true problem with posterior neck pain most times is the anterior neck muscles are too tight. This is the sternocleidomastoid muscle that runs here in the front of the neck. The sternum and the clavicle attaches and then runs up and attaches to the mastoid process, which is the bone right under your ear. But the main job of this muscle is to rotate the head to the left. And if I get Victoria to turn your head to the left, now you see how it tightens up when she did that. It come back to the middle. There you go. And then the one on the left turns the head to the right. But when these muscles get too tight, they pull the head forward like that, in a forward head position. And that's what causes the pain in the back of the neck. Constant pulling and straining of the posterior neck muscles when these muscles get too tight. So the best way to work these muscles is to just lightly grip it and hold it in between your fingertips, and then just knead the muscle gently. Work your way all the way up. And I'm not pushing down into the neck because the carotid artery is right below it. So you don't want to press on the carotid artery, but you can grab this muscle and lift, kind of lifting it with the back of my fingers and in between my thumb. And almost like I'm pinching it all the way around and then lifting it off the neck. And then just kind of knead it gently. Is this hurting you, all right?
I'm good.
Okay. So always check in with the client to make sure that they're tolerating it well. It might be a little uncomfortable, but it's not supposed to be painful. And work your way all the way up to the mastoid process. And you can friction rub the mastoid process attachment along that bone. And then also you can friction rub the sternal attachment where it attaches to the sternum or the breastbone, and you can friction rub the clavicular attachment where it attaches to the clavicle. And then you repeat this on the other side as well. And then the middle scalene, which tilts the head to the side, and then posterior scalene, which is back more on the side, toward the posterior side, it tilts the head back and to the right. The anterior scalene tilts the head up and to the right, like that. So to work these muscles, you just kind of get straight under the sternocleidomastoid and just start gently pressing and kneading into it. How's that pressure, Victoria?
It's good.
Feels okay? And we work that muscle all the way down. It goes down to the second and third rib. So you can't really get to the attachment sites on the rib. You get down to the clavicle, that's about as far as you can go. And then work the side all the way up to the side of the neck. The transverse processes, the little bony projections on the side of the vertebra where they attach. And you can stroke up the back side to get the posterior scalene. You can do a trigger point therapy or an active release technique for this. That's good to do is to press into the muscle. And I tell them to tell me when to stop. If they had a pain scale of 1 to 10, 1's no pain, 10's the most pain they've ever felt. Tell me when you get to about 4 or 5 on this pressure here, okay? Victoria, you tell me when to stop. I'm going to push directly in on this anterior scalene. All right, how's that? Is that good right there?
Yes.
Is that about a 4 or 5 on a pain scale? So it's slightly uncomfortable, but not painful. And now I'm going to support the side of the head. I want you to tilt your head to the right. Tilt your head, your ear to your right shoulder. 2, 3, 4, and relax. Let go. And I'm just holding this pressure while she does isometric contraction. Contract, tilt your head to the right. 2, 3, 4, and relax. And I'm pressing in the whole time. And then can follow it down into the attachment site down near the ribs. And that's just a good active release technique to get that muscle to release and let go. Another great technique to release the sternocleidomastoid muscle is a side lying position, where I was working on Victoria's right side, now I'm working on her left sternocleidomastoid muscle. And to get this muscle to release, you just get your fingers up underneath the collar. I'm not pushing into her throat. I get up underneath the muscle and I'm lifting it up in this upward direction. And then you can get your other hand in to grab with a couple of fingers. Now you've got a good grip on that muscle. You can see it right there. And this is the anterior, or the sternocleidomastoid muscle that pulls the head forward. And this one in particular turns the head to the right. So to do an active release technique on this to get it to loosen, we will have Victoria, once I get a good grip on it like this, I'm not hurting. Are you feeling okay? Does that hurt? Good. Okay, I have you turn your head to the right. 2, 3, 4, and relax. Let go. Good. I'll get it with one hand so you can see what I'm doing. All right, and turn your head to the right. 2, 3, see it pop up. 4, 5, and relax. Let it go. And when she lets go, that muscle just kind of relaxes a little more than it did before. The whole point of active release techniques is you activate the muscle, then you release it. You activate the muscle and you release it. And by doing that, the brain sends a signal to the muscle to tell it to relax. And it's a more effective way to get muscles to release than just massaging them or kneading them or not get the client involved. I like to get the client involved and get them moving the muscle and using the muscle that I'm trying to release, and it will release a whole lot quicker. All right, one more time. Victoria, turn your head to the right. 2, 3, 4, and let go. And I'm just kind of holding pressure. And then as that muscle releases, sometimes I go a little bit deeper. I get a little higher up on her here. Turn your head to the right. 2, 3, 4, and let it go. Relax, let it go. How's that feel?
Great.
Feels good? Does it loosen up a little? Now it feels a lot more pliable. It's a lot softer than it was when we started.